Artificial intelligence and machine learning. The biggest question is, are they same or different? And why even you should care about that? So whether you are just wondering or deeply involved in the tech, let's find out today. Imagine this. A patient arrives at the hospital complaining of the chest pain. The doctor runs some tests, look at the x-ray, and uses a smart system to help analyze the data. And that smart system says this is at the high risk. And doctor investigates further and discovers a tumor early. Treatment begins, patient recovers, and everyone celebrates. Then someone came in and asked the question, okay, that is great, but is this was done by AI or is this was by the ML? That's a big question here. The system that was being used by the doctor to analyze the data and it came up with the high risk results that saved this patient's life. Now that credit goes to who? AI or the machine learning? Right. And let me tell you, most people don't know. This is confusing a little bit. Today we are going to clear up the confusion. Welcome to the Test Guardian, where we explore how to make AI fair, ethical, and unbiased. I am Katie, your host and guide in this journey. And in this video, we will deep dive further into AI versus machine learning. Let's understand first how exactly AI system works and what it is. So this person walks into the hospital system, right? And as soon the person arrived, there's a facial detection system in place, and that look this man and says, "Hey, welcome, Mr. X, and your appointment with Dr. Chen is at 9:30 a.m. You are here for your annual physical, or are you still dealing with that cough from the last month?" So it analyzes your patient's record, understand your last visit details, even ask the relevant follow-up questions, and based on your answers, it directs you. Please proceed to the exam number room 2. And Nurse Sarah will be with you shortly to take your vitals. Now, see, this system is designed to think and act just like human beings. This is what this AI system is. When you go to your doctor office, you're going to experience the same thing. The person is going to ask you multiple questions. Hey, how are you? Are you here for the annual exam? Are you having still the old previous symptoms from the last month? Exactly same behavior you're going to expect from this system, which is called AI, right? So it just think and act like a human receptionist, making broad decisions and interacting with you in very intelligent and conversational way, right? So remember, the biggest question here is it's a conversational. It is not just question and answer, it is conversational way. Whatever your response would be, it's going to generate next question based on that. It just have a human like understanding of your situation and your answers. And that's, my friend, is a simplified picture of artificial intelligence. It is a big umbrella, the grand vision of creating intelligent machines that can reason, learn, perceive, and understand the language and solve the problems just like humans. Now, let's reset. Now, this time you walk into the different clinic and there's a simple touchscreen kiosk, right? It asks for your name and the date of birth. That's it. And you submit the form. So what exactly it is doing behind the scenes, it pull up your basic appointment information. But here's the clever part. This kiosk has stored data from thousands of patients' checks in over many years. Like all the patients are coming in, they're all checking in. This data is being saved at some place, and this system has access to this database, right? And it has identified a consistent pattern in it. The patients who check in on every Tuesday between 9 to 11 a.m., that's a pattern it is recognizing from this database. The patients who come at Tuesday between 9 to 11 a.m. and whoever has selected like annual exam during this time frame and the day, they are always being directed to room number 4. I hope you are getting what I'm trying to say. So this system, this is not facial detection, or it is not asking many questions. There's a just simple form, fill up your name and date of birth, and you submit. It access to the database. The database has all the records of millions of check-ins already, and it identify and learn the pattern that whoever comes here on Tuesdays 9 to 11 a.m. and then they select the annual exam, they are always directed go to the room number 4. So what is going to happen now is when you check in on Tuesdays, you select the annual exam from the menu in the kiosk. The system will immediately display your appointment is with Dr. Chen. Please proceed to room number 4. It did not understand your needs in the human sense. It did not have any conversation with you. What it did was analyze tons of past data. It just analyzed it. The patient's check-in data to learn this pattern and make a very specific, accurate prediction for your room assignment. That is what it is doing. It is predicting in what new room number you will be sent to. And this process of machine learning from data to make a specific prediction or decision without being programmed for every single possibility, that's machine learning. It is a key technique, a powerful tool within the broader field of AI. And you can say that if AI is this much, then machine learning is part of it. That completes the AI. Now, let's understand the AI and machine learning amidst the grand vision in actually how it works in the hospitals, for example. Imagine the AI system in the hospital acts like a super consultant, right? And it looks for the patient's entire medical history. So this is a system and that is analyzing like DNA, X-rays, the vitals, any symptoms, any diagnosis. So everything is connected to this big system. It is just analyzing that, right? Even your lifestyle, then it can cross-reference all of that with millions of medical journals, clinical trials, patients' outcomes globally. And this AI system would then process the most likely diagnosis, suggest the most effective treatment plan, and even predict potential complications, all with incredibly high accuracy. It's an intelligent assistant helping doctors make the best decisions. So this is what the AI system works. Let me recap that again. There's an AI system. It has access to your health database, your previous symptoms, your visits, your DNA, your X-ray, your all scans, blood reports, any treatments, any medicines you were given, reactions. It has access to all of that data. It understands from that data, and then it access all the possible medical journals, treatment plans, or for the cross-reference evidence. It's going to check all the millions of those record, even the trials or whatever it is. It is going to confirm with that. Okay, so this person have this case. What could be the possibly the problem here is, and what would be the best solution? It is going to give it to the doctors. So this is what exactly it does. See the difference. This is a one person. The doctor is one brain, one person. This person cannot compare your all symptoms with millions of records every day. This is why this system works really great and it is very precise. Think about as a skin cancer detection, and dermatologists often look at the moles. So the machine learning model, there's a machine learning model and it is being trained on millions of thousands, hundreds and thousands of pictures of moles where there are two parts of the pictures. One is with the cancers and one is not with the cancers. So you feed all these images to the model, it trains and it learns from this data. And after that, the doctor is going to use this model, and then doctor is going to give a photo of mole to the machine learning model and ask the system, tell me if it is a cancer or not. And this is how the model is going to respond back, right? The machine learns from the visual patterns that differentiate the cancerous and non-cancerous moles. This is what exactly it does. And it predicts with very high accuracy. So just thinking like a doctor, but it is exceptionally good at specific pattern recognizing task. So that makes this system really great and wonderful. For example, there's a disease called specifically to eyes, which is called diabetic retinopathy. Now, Google DeepMind, they developed a machine learning model which can detect disease just by scanning your eyes and your retinal scans, and it can predict if you have a diabetic retinopathy disease or not. And often it is outperforming human experts in speed and consistency. That is how machine learning is being used in healthcare for the disease diagnosis. This is a predictive analytics for the hospital readmission. Now, hospitals, they want to reduce the readmission because which are costly and can include, it can indicate the issues with the patient's care, but the challenge the doctors are facing or the hospitals are facing, there could be sudden flow of the patients, which is unpredictable. So if they can use any machine learning model to predict that, that would give them a heads up time to be prepared, right? And machine learning model can analyze a patient's demographics, past medical history, their discharge care plans, and predict their likelihood of being readmitted with a certain time frame. And that allows the hospitals to intervene with targeted support for high risk patients. And now, what exactly do? The patient is sent back to the home after surgery. Now, this machine learning system says this patient that you just had a surgery maybe will be back in 30 days. There's a higher chances. And the hospital is going to arrange in-house visits for this patient to keep an eye so that it doesn't like turn to some emergency case. So they can keep an eye on the patient, look for any symptoms, and if anything shows up, just provide the necessary treatments as soon as possible. So this is how beautiful and good this machine learning system is. It can save like many lives. And many hospitals are now using this ML program to identify patients at high risk and allowing for earlier intervention and improved outcomes. That counts the theory part, how the AI and ML is different. And but why does it matter? Right? Let's get to know about this. There's a reasoning in the AI, and there's an accuracy and the robustness. So AI works on the basis of the reasons, and it makes decision based on those reasons. But you have to keep an eye on, is it biased? Can it explain why it does something, right? And in terms of testing, you have to perform the adversarial testing, which is like trick the AI. So you're going to ask such a questions which you know the answer could be wrong, and then make sure that AI is responding as per that. And you have to justify its output. It should be able to explain like why it is taking certain steps. So if you analyze the pattern here, just act like you are a machine learning model, and you are trying to find the pattern here. So that it's very common that it's a reasoning, it's taking decision, and it is providing with the explanation. So it's more like process oriented work. If you see the pattern here, anything which involves the process, thinking, creativity, That is where the AI comes in. Now let's go to the ML part. Did it learn from the data? Can it handle the unseen data? If the input change, does the output remain the same or does it change? So that is more like what AI and machine learning difference is, right? So it just learns something from the data. And after that, when you use that model, you provide something new. Can it handle that very well? Is it able to compare that old database with the new unseen data and give you the results? If the input is slightly changed, for example, um, electric or I would say autonomous vehicles, if the visibility is good, it's going to perform better. But what is going to happen if there's a fog or heavy rain? The visibility is next to zero. The input is changed to the system, and then is it going to still keep driving or maybe crash? As a tester, you need to work on the precision and the recall numbers. But don't worry, we're going to work on that. You have to keep an eye on the overfitting and the data quality. And that is our next episode. And is training data is biased or not? If yes, then the skin tones. There was a machine learning model which was being used by dermatologists to find skin cancers. Now that model was trained on specifically white skins only. I mean, it was given pictures maybe mostly who has highest value of white and fair skin tones and less numbers of black, dark, or brown skin images. So the model learns from only certain kind of images, but it fails to identify that cancer in black, brown, or dark skin. That is really concerning if it is biased, since this was biased toward the white because it was trained on that images. Minor change in skin tones can break the system. This is why the testing is really very critical in the AI and machine learning systems. Let's jump to the next slide now, the comparison. In short, I can say the AI is a big idea. For example, autonomous car, self-driving cars, right? Self-driving cars and the chatbots, it's a big idea. But the self-driving car has its own various components. Like there's a camera that tracks motions, stop signs. It look for that and learn from all those stop signs. And that stop sign that it actually find, that is the machine learning program. So if you can see, this is a big umbrella. This is AI, and this is the machine learning models that it use the brake system and accelerator or race. These are the machine learning programs that it uses, and it works on the rule based. So it does have its own rules, how it's going to work, how it's going to process the information. For example, you want to fly from point A to point B. That's a grand vision, right? And there are many ways to go there. An airplane is a way to go there. That's it. Airplane is a machine learning, and this vision you want to go from here to there is a AI. And in terms of machine learning, it learns from the data and it improves itself by making mistakes. Then it's going to learn. There are no rules. Whatever data you want to provide, it just learn. So yeah, so I already gave this example about the airplanes. And in terms of the AI and machine learning, how the difference is, like answering the patient's questions and the queries, analyze the reports, even recommend the treatments, and the chatbot conversation. So that's AI. We already discussed all these scenarios. In terms of the machine learning, it's going to predict the outcomes, and we already discussed that as well. Analyze the x-rays, learn and improve further. So that brings us to the last slide, and let me recap. So AI is a goal of making machines smart. And machine learning is a method AI uses to improve itself. To our amazing listeners, Give yourself a big high five. You are just mastered a tricky difference that confuses many people. Now you truly understand AI and machine learning with real world examples. And I must say, celebrate this win and keep the burning desire alive. And let me know what topic or questions about healthcare AI testing should we cover next. I will read your comments and use them to shape future episodes because this is a collaborative journey. And together, let's build a community of people who care about safe, fair, and reliable AI. Thank you for watching. This is Test Guardian, where we make AI reliable, ethical, and unbiased. I have been talking about data and dataset a lot here. In next episode, I promise I'm gonna talk about it. And let's find out what is dataset and its types. Signing off for today. Stay tuned. See you in next episode.